Do you ever find yourself walking less steadily than before, even without an injury? Is there a time when just standing up from a chair, your legs react a little slower, making you grab onto something for reassurance? Or have your calves ever cramped in the middle of the night, forcing you to massage them for a minute before they eased up? Sometimes it's just a heavy feeling each morning, your legs feeling like they're weighed down with lead, even if you didn't overdo it the day before. These things aren't random, and they're not necessarily just about age. I've met many people like this. They come in for these vague sensations. They don't have clear pain, no serious issues. But upon closer examination, their bodies had been silently warning them for a long time. And the most surprising thing of all, many of them never thought they were calcium deficient. They still ate well, still believed they weren't lacking any nutrients. But the issue isn't about how much you eat, it's about how much your body can actually absorb. And when that ability gradually declines with age, the deficiency arrives, quietly, day by day, without a sound. I'm making this video not to give a long list of recommendations, but so that you, at an age when you need to listen to your body more closely than ever, can recognize these signals in time before they turn into something bigger. Because sometimes, just a small adjustment, a supplement taken at the right dose and the right time, helps your body avoid withdrawing from its bones to compensate for deficiencies. I won't say too much here because I want you to see for yourself that what's about to be shared is logical, necessary, and most importantly, truly easy to understand and apply. We'll go through the 5 most common situations in people over 60, which I've seen repeatedly over many years in the clinic. These are situations where, if you understand them clearly, the decision to take calcium or not will become obvious, no longer relying on guesswork, advertising, or hearsay. I don't believe in miracles, but I do believe in understanding, and I believe that with just a little timely knowledge, any of us can maintain a steady gait, stay proactive in life, and keep the faith that we still control the most important thing, our own health. We'll start with what seems like the simplest thing. Why do you still lack calcium, even with a normal diet? From there, small doors will open. You just need to stay, and I'll walk the rest of the way with you. I once met a woman in her 70s, small in stature, slightly hunched, very spry, but she'd always complain of tired calves after standing in the kitchen for a long time. She'd say, "I eat regularly, drink milk every day, so why am I so tired?" That question wasn't new, but every time I heard it, I felt for her. Because at this age, eating regularly isn't about how much you eat anymore. It's about how much your body can actually retain from what you consume. As we age, our ability to absorb calcium from the gut starts to decline. Even if we eat enough, the body just doesn't utilize it as efficiently as before. The reason isn't that we're eating wrong, it's that our small intestine and digestive system aren't working as well as they did in middle age. It's like an old sponge. No matter how much water you pour on it, it won't hold much. Not to mention our exposure to sunlight, which helps our body produce vitamin D and aids calcium absorption, gradually decreases. Many people avoid the sun or apply thick sunscreen year-round, so while you might have the calcium, the transportation isn't sufficient. If there isn't enough calcium in your blood, your body will have to temporarily withdraw it from your bones to keep functioning. But that action isn't harmless. It's like pulling bricks from your house's wall to build somewhere else. Gradually, your bones weaken without you even realizing it. A study from the University of Auckland once showed that in older adults with a prolonged calcium-deficient diet, consistent supplementation of at least 500 milligrams per day helped slow down bone loss. But most importantly, in my opinion, it's not about how much you take, but knowing when you need it and how to ensure your body actually gets it. I usually advise patients to start with food, not pills. Yogurt, cheese, sardines, leafy greens like kale, almonds, tofu. These aren't unfamiliar foods, but they're often overlooked because eating them all the time gets boring. The issue isn't the food itself, but how you prepare it to suit your palate and digestion at this age. For instance, some people don't tolerate milk well because it causes bloating. In that case, I'd suggest they try unsweetened yogurt or a softer, easier to digest cheese. Canned sardines, lightly baked with a little olive oil and fresh lemon, can be a surprisingly fun dish that provides just as much calcium as a supplement. But if you're unable to get 1,000 milligrams of calcium each day from your meals, which is common among many older adults who live alone, cook simply, and eat small portions, then supplementation becomes necessary. I usually start with a 500 or 600 millimole tablet of elemental calcium, split between morning and evening, taken right after the main meals. Why after meals? Because when there's food in the stomach, calcium is absorbed more efficiently and is less likely to cause gut irritation or bloating. I've seen many people give up on supplements simply because they took them on an empty stomach and then experienced bloating or mild nausea. They assumed they couldn't tolerate calcium, but in reality, it was just a matter of poor timing. One more thing, don't forget vitamin D. It's an indispensable travel companion for calcium. I usually recommend a dose of 800 to 1,000 units daily, depending on blood test results. Some people prefer combination pills, while others separate them, depending on individual preference and pill-taking habits. I also want to share something few people pay attention to. Not everyone needs to supplement calcium for life. There are periods when the body needs more, such as after a severe illness or when the diet is very restricted. But there are also times when, if your meals are good, you're getting enough sun, and your bones are stable, you can temporarily stop or reduce the dosage. The important thing is to monitor regularly, get periodic checkups, and not supplement based on intuition or what your friends do. And if you're wondering whether you fall into the calcium deficient group, pay attention to your body. Do you easily get cramps at night? Do your calves feel tired after a bit of walking? Have you ever had a minor fracture or heard your doctor say your bones are a bit brittle? These are all subtle but noteworthy signals. Finally, I want to say this. Supplementing isn't about just taking it to be safe. It's a decision that requires knowledge based on your body's true needs, and it's only effective when combined with appropriate eating and exercise habits, because calcium isn't a miracle. But used at the right time and in the right way, it can help us maintain our independence, our stability, and our peace of mind with every step we take each day. Of course, not everyone waits until they're deficient to start thinking about calcium. Some people have already received a clear diagnosis from their doctor or even experienced a minor fall with severe consequences. In those cases, calcium supplementation isn't a question of should I or shouldn't I, but a mandatory consideration, a crucial part of maintaining the strength of a skeletal frame that has begun to weaken with age. I vividly remember an elderly gentleman in his mid-70s, tall and still agile, who came to an appointment using a cane. He said he had simply tripped over a rug in his bedroom and fractured his wrist. Just one misstep, doctor, and I had to be in a cast for over a month. That seemingly small story spoke volumes. When bones are no longer strong, even minor accidents can lead to severe consequences. Osteoporosis doesn't come on suddenly. It progresses silently, little by little, as bone breakdown starts to outpace bone regeneration. And the sad truth is, after menopause or turning 60, the body naturally begins to dismantle bone mass if it's not properly maintained. I often compare bones to a house. Calcium is the main material, the bricks, the cement. If you're taking medication for osteoporosis but don't have enough building materials, the medication's effectiveness will be greatly reduced. That's why any treatment plan always starts with a simple question. Have you been supplementing enough calcium and vitamin D? A highly valuable study from France, published by Chapuis and colleagues, showed that in women over 75 living in nursing homes, supplementing with 1,100 milligrams of calcium daily, along with 800 units of vitamin D, helped reduce the risk of hip fractures by nearly half. This number isn't just a statistic. It represents a very real hope for millions living with osteoporosis. Of course, not everyone needs to take as much as 200 milligrams. If your daily meals already provide a portion, you only need to supplement the rest. I usually guide patients to make a rough calculation from their food intake, then decide on the missing supplement amount. For example, a tub of yogurt can provide 200 to 300 milligrams, a glass of milk around 300 milligrams, and with some leafy greens and canned fish, you might reach 700 to 800 milligrams. The remaining amount can be supplemented with a 500 milligrams pill at dinner when the stomach is working at its best. I know many people are hesitant when they hear about high doses. They're afraid of kidney stones, calcification, bloating, and that's totally reasonable. But the issue isn't the number, it's how you take it. Take it split into 2 doses daily, with food, and monitor with blood tests or regular checkups. The important thing is not to take too much at once, and not to combine calcium with medications that can cause interactions like tetracycline antibiotics or iron. I often tell patients, if you've had an unexplained fracture or have been diagnosed with osteoporosis through a bone density scan, then supplementing is no longer a should I or shouldn't I, but a how do I do it right? I also want to share a small tip I often use for older adults who dislike taking many pills. Ask your doctor or pharmacist about chewable or effervescent calcium forms. For those who often forget their medication, a glass of orange juice in the morning with a dissolved calcium effervescent tablet can be much more convenient and pleasant than a hard-to-swallow pill. Additionally, there are smaller pills available that can be taken in divided doses throughout the day without causing stomach upset. Calcium's role in osteoporosis treatment. Another crucial point to note, osteoporosis medications like bisphosphonates or denosumab won't achieve their maximum effectiveness if the body has an underlying calcium deficiency. I've seen many people continue to lose bone despite consistently taking their medication. Upon closer investigation, it turned out they weren't supplementing enough calcium, or they forgot the accompanying vitamin D. Overlooking these small details can undermine the entire treatment process. I'd never encourage casual medication use, but if you've started the journey of treating osteoporosis, proper calcium supplementation is non-negotiable. It's like consistently pouring cement into a cracking wall. You might not see it immediately, but it's the foundation for keeping everything else stable in the long run. If you've ever had a fracture from just a minor fall, or if a bone density scan showed low results, then don't hesitate. Start by reviewing your daily meals, then ask your doctor if you're getting enough calcium, and after that, choose a supplementation method that suits your body, not just to prevent further fractures, but to regain peace of mind as you walk through everyday life. Because at this age, every time you stand up steadily, it's not a small thing. It's a quiet manifestation of freedom, dignity, and the silent strength you still hold within. After discussing the more obvious cases like osteoporosis diagnoses or previous fractures, I want to bring you back to the quieter signals. These are signs that are sometimes overlooked, but they are the first words your body tries to send you every day. I often ask patients a simple question: have you been getting nighttime leg cramps recently? Many nod quickly, sometimes with a wry smile, saying, just occasionally, probably from sleeping in a weird position. But when I ask more deeply about the frequency, accompanying sensations, and when they occur, it turns out quite a few people have been living with this condition for months, even years, without ever thinking it could be a sign of calcium deficiency. Calcium doesn't just play a role in bones, it's involved in muscle contraction, regulating nerve transmission, and keeping the nervous system and muscles working smoothly. When blood calcium levels drop even slightly, though not yet dangerously low, the body can react with involuntary muscle contractions, slight eyelid twitching, a tingling sensation in the fingertips, or sudden cramps while sleeping. I once treated a retired teacher in her 60s who frequently woke up in the middle of the night due to severe calf cramps. She used to think it was due to daytime activity or the weather, but when her blood was tested, her calcium level was only around 8.5 mg/dl, slightly below the safe threshold. After a few weeks of dietary adjustments and gentle supplementation, her symptoms gradually disappeared. A study by Fong et al., published in Osteoporosis International in 2005, showed that mild calcium deficiency is one of the common causes of muscle cramps in older adults. The good news is that this condition often improves quickly if detected early and supplemented correctly. For people with mild symptoms, I don't rush to prescribe medication right away. The first step is always to look at their diet. Are they deficient? Are they avoiding dairy or restricting fats? to the point of eliminating natural calcium sources? If so, then a daily yogurt, a handful of dry roasted almonds, or a few pan-seared salmon slices can be a very good start. If there's no improvement after a few weeks, or if blood tests show calcium levels below 8.8 mg/dl, then I'd consider adding 500 milligrams of elemental calcium daily. And of course, I'd also check vitamin D levels because a D deficiency also reduces calcium absorption, leading to a cascade of adverse reactions in the body. In special cases, when muscle cramps are accompanied by fatigue, rapid heartbeat, or persistent tingling in the limbs, I'd also consider other factors like magnesium and potassium. Many older adults who take diuretics or antacids long-term are prone to combined deficiencies, making symptoms even more uncomfortable. In these situations, I might prescribe gentle magnesium supplementation in pill form or through foods like pumpkin seeds, whole grains, or soft-boiled black beans. Here's a small tip I often share with patients. If you frequently experience nighttime cramps, try soaking your feet in warm water for about 15 minutes before bed. You can add a little Epsom salt. It helps relax muscles and gently aids the body in absorbing magnesium through the skin. And don't forget to drink enough water throughout the day. Even mild dehydration can increase neuromuscular excitability, leading to sudden muscle contractions. I know some people will ask, then why do I still get cramps even after taking calcium? At that point, I'll ask in return, when do you take it, with what, and are you taking any other medications with it? That's because taking calcium on an empty stomach can cause discomfort. Taking it with iron or antibiotics can reduce absorption, and if there's no vitamin D accompanying it, it's like pouring water into a bottle without a funnel. Most of it will spill out. I also want to emphasize that symptoms like muscle cramps or persistent numbness and tingling shouldn't be taken lightly, nor should you self-diagnose and buy supplements indiscriminately. Each person might have different underlying causes, and the best approach is always to start by observing your own body, then seeking information from reliable sources, or directly asking a doctor if you suspect a true deficiency. Finally, if you're experiencing these symptoms, night cramps, inexplicably tired calves, or a slight twitching sensation in your muscles, don't quickly dismiss it as just getting old. It might just be a small deficiency, and by listening a little more closely, you can make timely adjustments to help your body feel lighter again. If you've ever taken strong anti-inflammatory medications like prednisone or certain drugs for autoimmune diseases, asthma, or chronic arthritis, your doctor might have mentioned their unwanted side effects on your bones. And I want to elaborate on that, as this is a situation I encounter quite frequently in my clinic. I once saw a 65-year-old male patient who had been treated for rheumatoid arthritis with corticosteroids for over a year. He had no idea that during that time, his bones had silently weakened. It wasn't until he got an X-ray for back pain that the images revealed a vertebral compression fracture. He was truly surprised because he hadn't fallen or sustained any impact. His back just felt tired after sitting for a long time, and then he felt a sharp pain when he stood up. This isn't uncommon. Corticosteroids, while highly effective at controlling inflammation, directly impact bone metabolism. They increase calcium excretion through urine, reduce calcium absorption in the gut, and most importantly, they inhibit bone-forming cells in the marrow. The result is that bone breaks down faster, without enough new bone being built to compensate. What's concerning is that this can happen after just a few months of medication use, especially in those taking moderate to high doses for prolonged periods. In fact, some studies show that continuous corticosteroid use for more than 3 months can lead to a noticeable decrease in bone density. NICE, a reputable UK medical organisation, recommends that individuals on prolonged corticosteroid therapy should be assessed for osteoporosis risk and begin supplementing with calcium and vitamin D from the outset. A study by Buckley et al., published in the New England Journal of Medicine in 1996, also clearly confirmed that calcium and vitamin D supplementation can reduce the risk of corticosteroid-related bone loss. I often tell patients that if they have to live with medication, they also need to know how to protect their bodies from its long-term consequences. In this case, bones are the most vulnerable yet hardest to detect area of damage. The solution I often use is a multifaceted approach. First, it's about adequate calcium supplementation, typically from 1,000 to 1,200 milligrams daily, depending on the calcium intake from food. Additionally, vitamin D supplementation is needed with a dose of 800 to 1,000 units to help calcium absorb better. I also emphasize dividing calcium doses throughout the day. Don't take it all at once. Split it into 2 doses after meals. This helps with better absorption and avoids bloating. For older adults who take many medications, I usually review their entire prescription to avoid unnecessary interactions. Calcium should be taken separately from iron supplements, tetracycline antibiotics, or bisphosphonates to prevent them from interfering with each other. A small tip I often share with patients is to use a wall calendar or a weekly pill organizer. This not only helps them remember to take their supplements regularly, but also makes it easy to spot if they've accidentally missed a dose. Especially for those on long-term corticosteroid treatment, consistency in medication habits is crucial. Monitoring bone health. Besides supplementing, I always encourage regular bone density monitoring, at least every 12 to 24 months. That way, the doctor will know if bone loss is happening rapidly and if further intervention with specific osteoporosis medications like alendronate or denosumab is needed. However, it's also true that not everyone who takes these medications will experience bone fractures. But if you've had low bone density, a family history of osteoporosis, or show signs of height loss or chronic back pain, then your risk is higher. And proactive prevention is much safer and more effective than waiting until complications arise. Finally, I always remind my patients that regular exercise is what truly helps calcium get into your bones. If you only take medication without moving or putting stress on your skeleton, your body has no reason to retain calcium in bone tissue. Gentle exercises like walking, yoga, or resistance band workouts can be excellent choices, even while undergoing treatment for inflammation. If you're taking corticosteroids daily or know a loved one who's on long-term strong anti-inflammatory medication, please don't hesitate. Ask your doctor about your bone health, review your diet, and if needed, start supplementing early. Doing so won't just help strengthen your bones, it will also bring peace of mind with every step you take, every time you stand up or sit down, things that seem small but are incredibly valuable at this age. I know there are times when the body is forced to stay still. A severe bout of flu, a hip replacement surgery, a mild stroke. Whatever the reason, when confined to bed for many days, we usually only worry about the heart, the lungs, or muscle weakness, but few people realize that bones are also being affected, perhaps even more than other organs. I once visited a patient 2 weeks after he was discharged from the hospital. His bowel surgery went smoothly, and the incision healed well. But what struck me was that he hardly wanted to get out of bed. Every time he stood up was a negotiation, and I understood. After such events, feeling weak, dizzy, and afraid of falling is natural, but I also knew that if he continued to lie down, his body would pay the price with its very skeleton. Bones aren't dead blocks of stone, they're living tissue. And here's the interesting part. Bones need pressure to exist. Every step, every gentle flex, every twist sends a mechanical signal to the bone, reminding the body that we still need this strength. Without those signals, the body immediately cuts back on new bone formation. Bone building cells withdraw, while bone resorbing cells continue working as usual. In just a few weeks of immobility, bone density can significantly decrease. A famous study from NASA, where astronauts live in zero-gravity conditions, showed they lost 1 to 2% of their bone mass in just 3 months. For older adults, the consequences can be even faster, as the regeneration process is already slower with age. That's why, for those recovering from illness, I always recommend reassessing their calcium intake. It's not about taking a lot, but about taking enough. Because when you can't move much, your appetite often decreases, your taste buds aren't as good, and absorption isn't as efficient. A thin bowl of soup or a few pieces of bread can't replace the real calcium your bones need. I usually advise patients to aim for about 1,000 to 1,200 milligrams of calcium daily during this period. Part of it can come from food: warm milk, soft cheese, canned fish, well-steamed broccoli. The rest can be supplemented with pills or a powder dissolved in liquid if dietary intake isn't sufficient. But beyond calcium, the most important thing is to help the patient get moving again, not walking right away, just turning over, sitting up, doing leg stretches in bed, deep breathing, balancing at the edge of the bed. I work with many physical therapists, and they always emphasize movement is a vital signal. Even small movements create opportunities for the body to recover. There's a trick I really like to use in such cases. It's called meal and movement pairing exercises. This means after every breakfast, I suggest the patient just take 10 steps around the room. After lunch, sit up straight and turn their head, stretch their shoulders 5 times. Actions tied to eating habits are easier to remember, easier to perform, and most importantly, they help deliver calcium from food to where the body needs it. For individuals who are bedridden due to underlying conditions, I also advise against using calcium types that cause digestive upset. If the stomach is sensitive or if they're taking acid-reducing medication, calcium citrate can be chosen over carbonate. It's gentler and its absorption doesn't depend on stomach acid. In some cases, I even prescribe chewable calcium for easier use when patients are fatigued, or effervescent tablets dissolved in water to both supplement minerals and encourage adequate fluid intake. I once monitored an elderly woman who was hospitalized for nearly a month with pneumonia. After returning home, she hardly dared to step onto the porch for fear of losing her footing. Her daughter took very good care of her, but it wasn't until I rechecked her bone density that we discovered a clear reduction in her lumbar spine. Fortunately, it was caught in time. With just dietary adjustments, light supplementation, and twice-weekly physical therapy, she was able to walk into her garden to tend to her flowers a few months later. That story always stays with me, because it reminds me that bone health isn't found in supplements, it's in every movement. Every time you stand up, every shoulder rotation, every small step each day, all of it is preventing your bones from wasting away. If you, or a loved one, are recovering from an illness, please don't forget about your skeleton. Ask your doctor how much calcium you need. Check if today's meal was enough. And if you're still hesitant to move, then start with the simplest thing. Move your body to let your bones know you still need them. Do you remember? We've covered 5 situations where calcium supplementation isn't just common advice, but truly essential. From silently prolonged dietary deficiencies to clear osteoporosis diagnoses. From seemingly harmless muscle cramps to long-term medication use or extended recovery periods. Each case is a unique story, yet they all lead to a common point: your bones are speaking. And the most important takeaway I hope you gain isn't just about how many milligrams of calcium to take daily or when it's best to take it. What I want to leave you with is awareness, proactiveness, the understanding that you don't need to wait until you have a fracture to start paying attention to the skeleton that has supported you for so many years. Calcium is essential, but it's not for everyone, not all the time, and not a the more the better situation. The right dose, at the right time, meeting the right needs, is what helps your body absorb it effectively and safely. And don't forget, no matter how good a supplement is, if you lack exercise, vitamin D, and consistency in your lifestyle, your bones can still thin day by day without you even knowing. I often tell my patients a simple truth. You don't need to change your whole life, just pick the smallest thing to start with. Maybe it's picking up the phone to ask your doctor if you need a blood calcium test. Maybe it's choosing yogurt instead of cookies for an afternoon snack. Maybe it's waking up 10 minutes earlier in the morning to stretch your shoulders and back. These small things, repeated daily, will build a solid foundation for your own health. And if, until now, you've thought of calcium supplementation as something only for the weak or the sick, I hope today that perspective might shift a little. Not because we fear fractures, but because we love our bodies enough to care for them before something happens. It's not because old age is something to dread, but because we know that every passing year is an opportunity to live more clearly, more lightly, and more steadily within our own bodies.